Hello, greetings everyone, and welcome to another episode of We Are in This Together. My name is Trudy Thomas, Senior Community Engagement and Accountability Officer of the International Federation of the Red Cross and Red Crescent Societies. So a few months have passed since our last episode, and there have been many changes since the beginning of the year. However, the topic in the media and conversations today focus on the new variants of the virus and the vaccines. So to discuss these issues, we have invited Dawn Byng of the IFRC. She's the health officer for the Dutch and English-speaking Caribbean. She's part of the regional health team of the Federation in America. Welcome, Dawn, and thank you for accepting our invitation.
Thank you for having me. It's a pleasure.
Great. So before we start the conversation, we remind you that we would love to hear from you, your questions, any concerns that you may have. And you can do this through our social media platforms or by using our WhatsApp line. And I will share that number. It is +507 6370 9973. That number again, +507 6370 9973. So feel free to send us a WhatsApp message and we will be sure to take those questions coming later down into the episode. It's also important to mention that some of the questions we'll be asking throughout the transmission have been collected through different surveys that have been applied in the region and feedback mechanisms implemented by the National Red Cross Societies in the Americas. So as I said before, we started 2021. This is one of the new episodes, of course, and 2021 signaled a new hope in the fight against COVID-19 with advances in the coronavirus vaccine. However, at the same time, we started to hear about mutations of the virus, which were quickly labeled with the names of where they originated. Dawn, could you explain what is meant by a new variant of the virus?
Okay. So all viruses, and this includes COVID-19, evolve over time. So when a virus replicates or makes copies of itself, it sometimes changes a little bit, which is normal for all viruses. These changes are called mutations, and a virus with one or more new mutation is referred to as a variant of the original virus. So basically, variants are changes that happens over time with every virus that exists on this earth.
Okay, thank you for clearing that up. But if the virus has mutated so many times, why is there so much concern about the variant?
So understand first and foremost that not all variants are dangerous. Viruses go through changes all the time. However, there are two kinds of variants that persons may have heard of in the media so far. They're variants of interest, and then they're variants of concern. So variants of interest describes newly emerging variants for which there's medical or public health importance, but we don't quite understand what they are just yet. We just know that viruses are normally changing. However, at the moment, we've heard of the Brazilian variant, and we've heard of the South African variant, and we've heard of a variant in the UK. These are variants of concern, and they are thought to be more contagious or likely to cause greater illness or severe disease, or may impact treatment or vaccine responses. So these are the ones that we're really concerned of, and they certainly are the ones that you would have heard of in the media so far.
So this is a question I was wondering. If a person had COVID last year, can they get infected again with one of these new variants?
Well, there have been reports of reinfection, and this is whether it's a new variant or not, but they have been very rare so far. Public health experts do worry that people who've recovered from previous coronavirus infections may be at risk of reinfection by the new variants that are out there. But at the end of the day, the WHO has indicated that continuing research suggests that immunity to the virus may last for at least 6 months. So if you've had the virus, you have between 0 and 6 months to possibly get this virus again. So this is, again, because coronavirus or COVID-19 is quite new. There's still ongoing research to understand what is taking place. However, according to Global Tracker, which is one of the mediums for tracking what is taking place with COVID-19, and I looked at a report that was dated in mid-February of this year, and in that it has reported that there have been fewer than 50 substantiated cases of reinfection worldwide. So that is 50 in the entire world based on data that they have collected. And in this region, or in the Americas, 5 of those cases were in the United States, as far as we know. So the numbers of persons that have been reinfected are significantly low at the moment, but ultimately, experts say that the threat of coronavirus reinfections means that people, including those who have already recovered from previous infection, should continue practicing social distancing, wearing the mask, and all of these all of these recommendations, because at the end of the day, whether you get reinfected or not, we must continue to wear your mask and social distance.
Right. Well, thank you for clearing that up, Dawn. But is it true that unlike the original virus, which had a high incidence in older adults, these new variants affect younger people more? Is that true?
So although experts in these areas where there's a new strain is appearing to have found an increased number of cases in children, again, we have to rely on the data, and the data shows that children are being infected by the old variant as well as the new variant. There is no convincing evidence that any of these variants have a special propensity to affect children. At the end of the day, what we need to focus on is that the persons who are most at risk are persons who are of a certain age. Yes, children are getting infected, but that has been the case across the board, and we are now seeing more cases of infection, so it's more likely that you would see more kids. But kids are still significantly at less of a risk when it comes to this virus at the moment, based on the data that we have so far.
Okay, thanks. So let's talk about vaccines, and we know globally this is a major topic. Are the ones being used effective against the variants?
So while it is true that the vaccines have different success rates against different variants, the perception that they don't work against variants is incorrect. In fact, the available vaccines have worked remarkably well so far, not just as preventing infection, but most importantly at preventing serious illness and hospitalization. And this is even as the new variants start to circulate across the globe. So I'm going to take a quote that I found by Dr. Anthony Fauci. He is one of the senior persons at the CDC, which is the American Center for Disease Control. He indicates that the bottom line is that vaccines we are using are very will protect us against the dominant variant that we have right now, and to a varying degree protect us against serious disease among several other variants. So at the end of the day, these vaccines are protecting us. One of the reactions of these vaccines is that even if you do get COVID-19 having had the vaccine, and this is also quite rare, that the impact of the disease on you having had the vaccine would be less than if you didn't have the vaccine in the first place. So the important thing is that you ensure that you attempt to access these vaccines.
Right. And well, there's a lot of talk everywhere and reports, and I don't know how true it is, about people who have been vaccinated and have gotten COVID-19 again. Is it true, or is that just rumors or misinformation?
So, end of the day, COVID-19 vaccines are known to be highly effective, but none of them are 100% effective. There's no medication out there that is 100. There are risks anytime you take any kind of medication or any kind of vaccine. This means that a small number of people might become infected after being fully vaccinated, but those infections, as I mentioned earlier, are typically mild or symptom-free. One of the things, again, with this vaccine is that if you have the vaccine, if you do by any stretch of the imagination still get this disease, the impact of the disease on you having had the vaccine would be less than if you didn't have the vaccine at all. So that is one of the positive things of having this vaccine. And again, no vaccine is 100% effective, no medication is 100% effective, but it is 99.999% effective. So please, again, the point is to encourage persons to have this vaccine.
Right. I was hearing a conversation a few weeks ago where someone was asking another person if someone receives one dose of the vaccine from one brand and a second dose from another brand, is that okay? Is that acceptable?
So the current recommendations are that persons should have the same vaccine for both doses. So there are studies, for example, in the UK at the moment, looking at using different vaccines for the first and second dose, but the results for those studies are nowhere near. We probably might get the results for those studies come the summertime of this year. However, let's focus on what is recommended by the WHO and by most health providers and by the CDC and other public health agencies, is that you should have first and second dose from the same company. So AstraZeneca is available in the Caribbean at the moment. You should have AstraZeneca for both your first and your second dose.
Right. Okay. Thank you for clearing that up. So as well, we tell our viewers this, we have been doing a number of perception surveys in Dutch and English speaking Caribbean around COVID-19. And one of the areas of distrust with regards to the vaccine that persons mentioned was that the vaccine was developed too quickly. So what can you tell us about this?
So before COVID-19 arrived, and COVID-19 has been with us since the end of 2019, there was research being done on other coronaviruses, and you may have heard of SARS and MERS. These are coronaviruses that existed some almost 10 years ago. So the research started in terms of dealing with these other coronaviruses since then. Now, and it is using that research that has supported research companies and organizations to develop the vaccine that exists now. So because COVID-19, which is a coronavirus, as you know, became a pandemic, there was a lot of funding from governments and even private enterprise going towards developing these vaccines. And again, this is what was happening in our more developed countries. So many people were being impacted. We saw it all over the news in terms of the countries in Europe and in the United States that was significantly impacted. So they threw lots of funds and research at finding a solution to this coronavirus. So that's another positive thing that contributed to how quickly this thing was developed. And also, when you're developing vaccines, you need to do trials. You need to have persons who volunteer to be part of those trials. Because there were so many persons impacted by the disease, you had many persons available to do these trials. So whereas a trial will have a first phase, a second phase, and a third phase, they were able to overlap these phases based on the numbers of persons who were available to get involved in supporting this effort. So those were three things that helped us to move the development of this vaccine forward a lot quickly than would have been done for some of previous vaccines. Technology has improved. There's so many things that contributes to the fact that these things have happened quickly. And we know we live in a world where everything happens quickly at the moment anyway. So this is really one of the positive things that has helped us towards getting towards having these vaccines within the last couple of years.
Right. Thank you so much for that answer, Dawn. I know a lot of our viewers can be at ease now with hearing that response. And another reason that we saw for distrust coming out of the perception surveys in the Dutch and English speaking Caribbean is relating to side effects. And I know we've been hearing a lot about blood clots, but we'll deal with that separately in another question that I have. But can you tell us about some of the side effects of the vaccine, if there are any at all?
So, so far, the side effects have been consistent with the side effects that you would find with standard vaccines. So for persons who have had children, for example, you would know that children, once they've had their standard vaccines, like the measles, their mumps, their rubella, there'd be a couple of days after they've had the vaccine, the kids would be miserable, they have a bit of fever. These are the kinds of symptoms that you would find having had the vaccine now. having had the COVID-19 vaccine. So what has been done in most places that are providing the vaccine is that they will say to you, please stick around for half an hour having had the vaccine so that we can monitor you. If within that time you have an allergic reaction, it would definitely happen within that time frame. But half an hour in the health center or public health institution where you have the vaccine is how long it will take, and they will check on you for that. In terms of, again, the symptoms that you may have or side effects, let's call them symptoms, not necessarily side effects. You can have a bit of fever, a bit of stiffness on your shoulder where you got the vaccine. You may have a headache. And these kinds of symptoms can be dealt with some paracetamol, or, just to have some rest, cool drinks, put a cold compress on your shoulder. These kinds of things would alleviate this thing that shouldn't last any more than a couple of hours, or even for 24 hours. However, if between 24 hours, 4 days, and maybe for a week later, if you are still having those symptoms, then you need to see your public health provider. There are also other symptoms that are possible, and this could be severe headaches. They can be blurred vision, they can be nausea and vomiting. If you start having those kinds of symptoms beyond that 24 hours, you need again to go and have a word with your public health provider. So again, just to give an example of some of the main symptoms or side effects, you may have abdominal or belly pain, you may have a bit of a headache, you may have a bit of nausea and vomiting. Again, if you have that for days later, go and have a word with your public health provider.
Okay. Thank you so much, Dawn. So let's talk about blood clots now. We've heard reports that 2 of the vaccines that have been distributed worldwide have caused blood clots in some of the people who received them. What can you tell us about this?
So what I can say so far, and remember, we have to focus on the science and focus on the data that is available. And so far, there's no definitive evidence that vaccines have caused blood clots. There simply isn't, not as yet. Research and data still being collected, but right now, nothing definitive. But based on the latest data available, the risk of thrombosis appears to be very low. That is, please understand that is the case. There's a whole lot of information in the media saying otherwise, but based on the data, risk of thrombosis, which are blood clots, are low. Data in the UK, for example, suggests that the risk is approximately 4 cases per 1 million, which is 1 in 250,000 in the UK, and in Europe is 1 person per 100,000. So again, this is a 0.0001% probability of persons getting a blood clot. At the end of the day, overwhelming scientific opinion is that there is no certain link between blood clots and the AstraZeneca vaccine. Understand that AstraZeneca are the vaccines that are mainly available in the Caribbean region, and the scientific opinion is that there's no link between the two, at least not yet. Nothing has been guaranteed. Regardless of vaccination, blood clots are fairly common given the sheer number of persons who've had the vaccines, and these incidents can be coincidental because at the moment, the persons who are most at risk are persons with pre-existing conditions. These are the kinds of persons who are more likely to have clotting issues in the first place. So again, no data as yet can conclusively say this. And this is especially true when we know that COVID-19, once persons have had COVID-19, the disease itself predisposes you to having blood clots. So again, the relationship between the vaccine and the clots, nothing conclusive as yet. The first thing that needs to be done with regard to this whole issue is to make sure that we are absolutely certain that the clots did not have some other kind of cause. So again, bottom line, there is no link that we could really make as yet.
Right, okay, thanks for that. And we're on the topic of vaccines, so I'm going to be asking you a question, and I know a lot of people here in the Caribbean and the globe have asked maybe their friends or their families, and I believe this was a hot topic at the office. And viewers, Dawn and I are colleagues within the same office. We sit like 6 feet apart, and ever so often I'll ask a little questions relating to health. So the question that I'm going to ask you is, are you taking the vaccine? Will you be taking the vaccine?
Once the vaccine is available to me, definitely I'll be having the vaccine. Thankfully, or at the moment, I have no pre-existing conditions that I know of, and I'm not at the age where I can have it as yet, because the vaccines, according to our Ministry of Health in Trinidad, is recommended to be had by persons who are over 65 and who have pre-existing conditions, and if you're a first responder. I am actually a first responder, but as yet, I am not entitled to have the vaccines as yet. However, I'll be first in line to have it if it's available to me.
Excellent, Dawn. So now what we're going to do in this episode, we're going to be taking a few questions from our followers and also to some of the questions that we got coming out of the surveys. So Keisha from Trinidad and Tobago asked, can I get the first dose with one brand of vaccine and the second dose with another brand? Well, I know you spoke about this before, Dawn, so we can still reinforce it again. You can answer the question.
Yeah, so just to reiterate, the current recommendation is that for the first and the second doses, you have it with the same brand. And again, because AstraZeneca is what is available in the Caribbean at the moment, you may not have a choice but to have the same brand. But basically, according to the research and recommendations made by the WHO, first and second dosage should be with the same brand.
Right. Roshan from Guyana asked, how long should I wait before doses of the vaccine and between doses, and does it make a difference depending on the brand?
So it does make a difference depending on the brand. So if you were in the United States where Pfizer and Moderna is available, then the time frame between doses is between 21 and 28 days. However, for AstraZeneca, which is available locally at the moment, it is a 12-week time frame within which you go from your first to your second dose. But again, there's research out there that is speaking to either increasing or shortening that time frame. However, recommendations at the moment are 12 weeks for AstraZeneca.
Right. Michelle from Grenada, she wants to know, why can't I get vaccinated if I'm pregnant?
So there haven't been enough vaccine trials done on pregnant women. Hence, until there's evidence of safety, pregnant ladies should avoid this vaccine, or it's not available to pregnant babies as yet.
Okay. Stephen from Dominica, he wants to know, why don't people under 18 years of age get vaccinated when nowadays we are vaccinated for other diseases from birth?
So the vaccines that he is referring to, or that Stephen is referring to, would be like your yellow fever, like your MMR, like your BCGs. These are vaccines that have been around for many, many years, and the recommendation based on how long they've been around is that these are to be had. These are childhood vaccines. Coronavirus hasn't been around quite so long. It's only just under 2 years old, the COVID-19 vaccine. So at the moment, in the same way that they haven't done enough research on pregnant ladies, there hasn't been enough research on children in terms of their accessing this vaccine. Mm-hmm. So until further trials are done, recommendations are that persons under 18 shouldn't have the vaccine.
Right. Another question we have, Sasha from Trinidad and Tobago, she asks, how do I know if I'm having a negative reaction to the vaccine?
So, as I indicated earlier, if you're having the vaccine in Trinidad, you are to wait in the health center for at least half an hour so that they can observe you to make sure that you don't have an allergic reaction or any kind of reaction at all. However, you should look for maybe headaches, maybe a bit of fever, pain at the vaccine site that should last no longer than 24 hours. And these kinds of symptoms or side effects can be dealt with some paracetamol, or you can put a cold compress on your shoulder. These are the kind of things that you need to look out for to see whether you are having a negative reaction to the vaccine. However, if you experience a severe headache that is not being helped by paracetamol, or that is getting worse, or if you're having leg swelling or any nausea and vomiting or drowsiness or weakness, and this is going on for 24 hours beyond, then you need to go and have a conversation with your healthcare provider, inform them that you've had the vaccine, and then they would deal with it accordingly. But just be aware of these kinds of symptoms and make sure that you quickly have a word with someone. However, if you're having an allergic reaction, that would usually happen quite quickly, and which is the reason why they keep you at the health center for at least half an hour after having the vaccine.
Right. We have a question from Sarah Ali Brown, and she wants to know, do vaccines pass through to breast milk?
As far as I know, I don't think there's enough research on that either. I do not think that they do. I'm not sure about that at the moment, but I don't think I have heard that is the case at all, no.
Okay. And the final question comes from Frederick from Suriname. He wants to know, is there much difference between the vaccine brands?
So the CDC recommends that the best COVID-19 vaccine is the first one that is available to you. Do not wait for a specific brand. All currently authorized and recommended COVID-19 vaccines by the WHO are safe, they're effective, and they reduce your risk of severe illness. So there isn't at the moment, as far as we know, any difference between the brands in terms of how they're made up. And this would take you into virology, which I am not. So there are differences in these vaccines in terms of how they're made up genetically. There's DNA and mRNA, but again, I'm not a virologist to best explain those. However, in terms of the brands as we understand them, in terms of their names, there's no difference with any of them. Make sure that you attempt to access a vaccine as the first one that you get. Don't turn it away. In any event, the only vaccines that are available in our region at the moment is AstraZeneca, and you should, as best as you can, focus on attempting to get that once you're within the appropriate group of persons who can access the vaccine.
Right. Well, Dawn, I want to say thank you for sharing a wealth of information with us on the new strains and also on the vaccine. Any last words or any final message that you'd like to share with our viewers?
Yes, it's just that I understand that many of us and many of you are experiencing pandemic fatigue. And even though there's a lot in the media out there about having the vaccine, and it is important, again, that you access these vaccines if you can, just remember to keep up on your social distancing, keep up on your hand washing, keep up on wearing your mask. And when I say wear a mask, over your nose and mouth, not just over your nose, even on your head or your chin. Please wear your masks appropriately and regularly, because that really, in spite of the vaccine, is the only way to get beyond this virus. So, and this is within the context of seeing in different islands in the region with this, certain increases in the numbers of cases that we're seeing. So please do, my main message now is to please continue, in spite of fatigue, to adhere to the recommendations made.
Yes, I do agree. And thank you so much, Dawn. And thank you to our audience for joining us. And we invite you to stay connected. Send us your messages, any questions that you may have, suggestions or doubts. You can follow us on our Cadron page, Facebook. We're on YouTube as well, and on Twitter. Also, too, we invite you to send us questions on our WhatsApp line. So that number again, it's +507 6370-9973, and that number again, 507-6370-9973. And thank you so much again for joining us, Dawn. And for all those who have been vaccinated, excellent. But just remember, you need to continue with the recommended precautionary measures. So wear your mask, wash your hands, and watch your distance. Signing off here for another episode of We Are In This Together, Dawn and Trudy from IFRC. And we want to say thank you. And until next time, goodbye. Stay safe, everyone.
Take care, everyone. Thanks for having us. Bye.